Hello everybody, this is Dr. Will Brooks, and this is our musculoskeletal anatomy review, The Avengers, one of several vodcasts I've prepared for you with high-yield information as you prep for Step 1. Our objective here is to use characters from Marvel's Avengers to review musculoskeletal anatomy. I do have one disclaimer. There may be a slight delay with regard to the laser pointer. This is due to a glitch in PowerPoint. It's not because of me. So just forgive me if the laser pointer is pointing to a structure that I'm not talking about. So we will use three characters from the Avengers in our study today. We'll look first at the Hulk. He provides a very nice look at superficial musculoskeletal anatomy to review various muscles. We'll also look at Captain America to help us with our studies of these muscles. And then we'll conclude by looking at the Black Widow. Now, the Black Widow, as played by Scarlett Johansson, provides a very nice specimen to look at the differences in female MSK anatomy. A very fine specimen indeed, I must say. Now, we can begin our study by looking at anatomy of the pectoral region and the neck. So here is the anterior part of the upper trapezius muscle. The Hulk has a very large upper trap as it attaches along the lateral one-third of the clavicle. In contrast, however, he has a relatively small sternocleidomastoid muscle, despite the fact that these muscles are innervated by the same nerve. Now, what is that nerve, I ask you? Well, do you remember? That's correct. It is the spinal accessory nerve, cranial nerve number 11. The Hulk has a very large deltoid muscle. We can see the anterior delt sitting right here. We also have the middle delt sitting right here. Now recall the anterior delt is going to involve with flexion, middle delt exclusively with abduction, and then the posterior delt along the back with extension. And the deltoid is innervated by the axillary nerve. The pectoralis major muscle is also quite large in the Hulk. The pectoralis major muscle is involved with flexion of the shoulder as well as internal rotation and also a deduction of the shoulder. And it is innervated by the medial and lateral pectoral nerves because the medial does more. Recall, it's the one that pierces through the pec minor to get to the pec major. And then we can see via these very large muscles a nice groove between deltoid and pec major, and that's called our deltopectoral groove. And there is a vein that travels up that groove, and you are correct, it is the cephalic vein. Very good job. So it's important to also remember how to test the accessory nerve, and it's done by having the patient elevate their shoulders or shrug their shoulders against resistance, and you can palpate or feel for differences in strength of one shoulder over the other because the trapezius muscle performs that action. And because the Hulk has such a large upper trap, I came up with a mnemonic to help us remember the action of the trap in this regard. And that mnemonic is, huge upper trap lifts acromion, which spells out the word Hulk. Now, I realize that acromion is spelled with a C and not a K, but a K fit in this regard. And that's not that bad, really, because you guys learned sulfopsum, right? That's not even a word. All right, now we're going to move on and look at anatomy of the extremities. So we can see a very nice biceps brachii and also a triceps brachii here in the upper part of the upper limb. We can also see a nice bulge for our brachioradialis, innervated by the radial nerve. And the brachioradialis, do you recall what it does? Yeah, it's a powerful elbow flexor when you're in the neutral position. And then down here we can see the Hulk has a pretty nice gastrocnemius. And we can also see his Achilles tendon. Do recall that when we test the Achilles tendon reflex, you're testing the S1 and S2 nerve roots. Now, unfortunately, we can't review anatomy of the anterior, medial, or posterior thigh because the Hulk's pants are, for some reason, always hiding that part of his body. I'm yet to figure out why the pants don't rip in that part. But anyway, it is important to note that the Hulk is at high risk of injury of the common fibular nerve because his pants are so tight. And recall, the common fibular nerve passes right there on the superficial side of the lateral knee. And so his pants are going to injure that nerve pretty commonly because they're so tight right there. And while we're on the subject of tight pants, what other nerve is at risk of compression by the Hulk's super tight pants? Can you think of one other nerve that might be at risk of injury here? Yeah, you're right. It's that lateral femoral cutaneous nerve, or the skinny jeans nerve. So that nerve passes right there under the pant line at the waist, and the Hulk may have some paresthesia of the lateral side of his thigh because of these skinny jeans as they become when he transforms.